I think that my main aims behind doing the project were fundamentally to improve the lives and make sure that the patients that I and other medical registrars look after around the country are made safer, and that we're offering the best clinical care that we possibly can. In addition to that, I am really keen that the project is seen as something that will mean people want to be medical registrars. It really is actually a hugely rewarding job, that everyone that we spoke to had positive examples of why they'd chosen to do it. And I think it's really important that future trainees realise that it isn't all about 4 o'clock in the morning and feeling horrible, and there's lots of really positive things about being a medical registrar. And of course, the other thing is I really don't want people that I see around me, my peers, who are perhaps being dissuaded from practicing internal medicine as a consultant. And what they do is they take up an internal medicine CCT, they start their training, and then they have some children or have another reason to work less than full time, and they pull out of it as a consultant. And I'm really keen that this project, as well as the rest of the work that's being done by the college, champions the role of consultants in internal medicine in trusts around the UK.
I think the main thing we want to achieve from this report is improving patient care. From my personal perspective and from hearing perspectives of registrars all across the country, I think the key to this is reducing workload. Only by reducing workload can we all offer the most acute and complex patients the time that they require, 24 hours a day. And I think that need needs to be met urgently. I also think that recruiting the best candidates into general internal medicine and to being physicians is crucial to patient care in the long term. And I think key in achieving good recruitment is ensuring that medical registrars are respected and valued in the way that they deserve to be, so that the role is given the credit that it deserves, and it's something that people aspire to do rather than dread doing, which I think is often the case when you talk to SHOs as how they're feeling. But also as a care of the elderly trainee, I would like to feel confident that even out of hours, complex, frail patients can get the care they deserve. And that's not only at a senior decision-making level, but that's on a level that every member of staff feels we should be able to offer patients. Frail patients, if they want help getting a glass of water, or wandering patients at risk of falling, we should all have the time to stop and help that patient, and not leave them feeling uncared for or at unnecessary risk. And I think it's a conflict we often feel as registrars. We're rushing to see an urgent case, and there may be a patient calling out from a bed for something they need, and it feels against human nature to simply walk past them. But there's that conflict. I want to help this vulnerable patient, but I'm also on my way to deal with a very urgent situation, and that's a horrible situation to be put in almost every shift that you encounter. And it's because everyone from doctors down to care assistants are very, very busy and flat out, and there are increasing demands from all patients, but in particular the frail elderly.
I think the main thing for me out of this, and from having spoken to numerous registrars across the country, is trying to restore a sense of pride in general medicine, so that medical registrars feel proud to deliver the best quality care that they can to patients, using all their skills, all their knowledge, all their training, and having time to invest in really doing the very best that they can and providing really good quality patient care. And I think by doing that, the sense of worth and improved morale will create a happier workforce and hopefully encourage more aspiring physicians in the future.